Hello, my name's Helen Allett from the Liverpool School of Tropical Medicine. In this lecture we're going to think about the mentorship process and a follow through from the start to the follow up and the ending of a mentorship relationship. So our learning objectives are to appreciate the stages in a mentorship relationship, to consider as we go through how we set goals, and to understand how the mentor-mentee relationship progresses. So getting off to a good start. It's really important that the mentor and the mentee get to know one another and establish a good rapport. And to do that, it's useful for you to understand your mentee's educational background and then to establish some mutual expectations from the relationship. So what do you both feel that will be gained from this relationship? So you need to know what your mentee's expectations are. And they need to know what yours are as well. And you need then to be clear as to your roles and responsibilities. So who is going to set the timing and the place for the encounters, whether they be face-to-face in a facility or online virtually or by telephone. So those times and dates need to be agreed, and what is going to happen during those encounters should be defined as well. It's important that you ask your mentee to identify priority areas for development and then set goals towards reaching the targets that have been set for those priority areas. So if a mentee has a burning issue, it's no point you come along and say, well, we're going to talk about something completely different, because their heart won't be in it. They have got a much more pressing need that requires assistance. So I've spoken about planning the practicalities of where and when you're going to meet and the preferred means of communication, and that's important. Some people like to communicate using tools like WhatsApp. Other people like to communicate by email. Some people might like a text or a phone call. So talk about which is the preferred method and maybe a backup method as well, in case something goes wrong with the preferred method. I think WhatsApp's particularly useful because it has that added flexibility of text messages or voice calls or even little videos. And it's encrypted, so it's meant to be pretty secure. You need to start off with establishing some rules, and particularly thinking about confidentiality, because sometimes it wouldn't be possible to promise your mentee that things would go no further if you come upon something that's very pertinent, for example, to patient safety. But in the main, most of what you discuss will be confidential between the two of you. It's always a good idea to have an agreement that you can both adhere to. Maybe you could sign, each of you, that will outline your expectations and rules of engagement so that you know what it is that you have agreed. So before you visit your mentee, if it's in a different facility than the facility that you both work, you may need to gain approval from the person in charge of the facility. It's not right to turn up at a facility to engage in a mentorship activity without the person in charge being aware of it. So make sure that you let them know and gain their approval. This may not need to be the case when you're acting as a mentor to somebody in your own facility, because the person in charge is probably already aware that such relationships have been established. So during your first visit or your first encounter, it's good that the mentees are aware of the tools that can be used as you go through mentorship and how to use them. So possibly things like the tools for reflection. It's a good idea to have a folder for each mentee And if you're menteeing them on the subject of emergency obstetric and newborn care, then that's what the contents of the folder should reflect. And make sure that your mentee has a clear understanding of the mentorship process, both the practicalities of it and the rationale for it, and the understanding of the whole point of it and the benefits of it. In terms of developing a rapport, then you can think through different ways of building up that relationship, and building it's really a relationship of trust above all else. So you want to think about what could gain your mentee's confidence and trust. You might consider sharing stories of your own clinical encounters, and that would include failures and successes. And you can be constructive as you reflect on your own failures, and this might help the mentee to open up. They realise that you're not perfect and that you've had to learn things too, and that you're just human like they are, really. So don't be afraid of sharing your own experiences with people, and particularly with a view to sharing what you've learned and how you've changed as a result. And really, you need to make the mentee understand that you're there to help them, that you're not there to just waste their time and take them out of doing what they really need to do, but that you're there to support them in their role and to help them to do it to the best possible effect. And that means avoiding displaying the know-it-all attitude, because you don't know it all. You're not them. And it's important, even though you are perhaps more experienced, that you approach the role of a mentor with humility and being a supportive side-by-side person rather than somebody who's looking down at the mentee from a great height. You need to take into account the workload and other responsibilities of the mentee, so you're not going to want to be an added burden to them in their busy lives, but rather something that your relationship can help improve their working life and practices. And because of that, we can't be too pushy, and we must be flexible and willing to adapt and maybe change plans from time to time. So together with your mentee, you're going to set some goals. And to do that, you need to consider what areas of knowledge and skills are most needed to develop, and how those relate to the job that the mentee is doing. So mentees may have aspirations to develop knowledge and skills in areas that don't relate to their current job, and that may not be the most useful thing to take forward at the current time. So it might be good to refocus on the skills and knowledge they actually need for the job in question. And consider what areas of personal effectiveness they would most like to work on. So it might be how you could be more effective in your record keeping, for example, or more effective in your communications and so on. And then as you set goals, think of milestones that you might like to pass on the way to reaching those goals. It's always good to have sort of targets on the way to your ultimate target, which may seem a bit of a way off otherwise. So here we are with a list of responsibilities. So thinking about the roles and responsibilities of the mentor in this relationship. So first of all, the mentor will perform a quick assessment of the mentees and of their working environment to look for possible gaps where there may be need for improvement, and then they can prioritize those various gaps and see what is perhaps more important, and then the mentorship can be tailored to have both long and short-term goals. Or you can think of those short-term goals as milestones, as we've just described, towards the ultimate goal. And then you need to think about making a quick plan of the most suitable method to provide that support to that mentee. So mentorship shouldn't be done rarely. It should be a fairly frequent thing. And I guess how frequently depends a little bit on your working relationship with that mentee. Do you work in the same facility? Do you work on the same ward, in the same operating theatre, and so on? Really, if you work together on a day-by-day basis, then every encounter should really be thought of as a mentorship encounter, although you can take time out of the clinical arena to perhaps reflect together. And you need to decide how often you want to have those reflections. Do you want to do it once a week, once a fortnight, once a month? And it's a balance of what's desirable and what's practical, really. If you are not working in the same facility, you might support the mentee through telephone calls during the weeks when you're not able to have face-to-face contact. And then you need to think about spending time with your mentees in the clinical area, working together, and you can coach them then focusing on improved patient care. And I think this is at the heart of mentorship. There's really no substitute for that side-to-side working relationship where you can set an example that the mentee can follow, and you can observe their practice to help suggest improvements and give them insights into ways to make their practice better. It's really important as you do this to pay particular attention to aspects of infection prevention and control, and also respectful midwifery or obstetric care. Think about helping your mentee to strengthen their communication skills and their referral skills between the various aspects of CMOCs and BMOCs and different levels of facilities. Think about the data collecting and the reporting requirements for your mentorship program, and try to keep a personal diary reflecting on the mentoring process if you've gone through it, because just as you're encouraging your mentees to reflect about their clinical practice, so you need to reflect about your mentoring skills and the process that you undergo, with a view to learning and making improvements. So in terms of the mentee, they should be committed to making time to spend with their mentors and proactively work towards making improvements in their care that they give to patients. They should receive constructive comments comments and criticism positively, and they need to identify the skills that they need to develop, and then communicate those to their mentor, things they want to learn that they're not secure on, and tell their mentor. The mentor's not going to necessarily know if the mentee doesn't explain to them. Sometimes people can look very secure in a certain practice, but actually they're feeling very insecure within themselves. So that's why we need them to tell us. It's good for the mentee to keep a personal diary themselves regarding their reflections and their thoughts about the mentoring process and what they're getting out of it. And then also, if there's any program-related data collection and reporting to do, they should be committed to doing that. So how do you make progress with your mentorship relationship? So key, I think, is to develop a focus on a particular area for development, and this will change as you progress, and you may have got one area sorted and then you move on to another one, a new one. You can discuss the issue in question and then clarify what success would look like, and assess the mentee's current level, where they're starting from, of both knowledge and skill, and then consider what needs to be overcome, what are the challenges to getting towards your goal, brainstorm the options for action, and then you agree with the mentee and have a joint commitment on the way forward towards that goal, and review the progress with your actions at the next meeting. So maybe you could think of how you could apply this to an example. So let's think of this example. So the mentee might tell the mentor that they lack confidence in conducting a safe vaginal breech delivery. So you might then start by assessing their current ability by asking them to demonstrate on a model if one is available. And then, having watched them do that, you can think of specific areas in need of improvement, and then ask the mentee for ideas about how they think they could improve. And those ideas might be, well, I'd like to watch you demonstrating the procedure so I can learn from how you do it. Or they might need then further practice themselves, or using their manual to make sure they're taking the correct steps in the correct order. They could construct a checklist so that they remind themselves, and they could use that as an aid memoir as they're practicing. And then when you meet them again, you can ask them how they got on and invite them to demonstrate their new skill and see if they've made all the improvements that you think are necessary, and then you could repeat that cycle if need be. So really good that they take charge of their learning like that, but you guide them through it. So as you persist with your mentoring encounters, whether they be visits or within the facility, think of having a schedule to implement your mentoring, and think about reviewing the performance based upon what you learnt together last time. Don't just leave it, but think about just refreshing before you move on to the next thing. You might need to prepare guidelines and some tools or a working aid, or you might need to have some key references or links to websites or videos, and perhaps have some mannequins available as well if possible. Be prepared to listen to the mentee and be flexible. Their agenda might be a little bit different to what you have expected. And then, as much as possible, try to think about setting some time to do some one-to-one case management observation. And I can't emphasize this strongly enough, how important it is to think about watching and observing your mentee as they manage clinical situations. And if you're doing that, it's really key that the patient understands what's going on, and that you don't just sort of turn up and stand there and don't tell the patient. I think it's very important to say to the patient, I'm just here to support whoever your mentee is and help them develop their practice. So I'm working with them today, and I'll be here as they take care of you to provide any support that's necessary, so that the patient's aware of what you're doing there, and you're not just a fly on the wall watching the birth process for no reason. So try and bring the patient in and make sure that they're okay with that. It's not everybody that wants an extra person watching them give birth, so make sure that they're in agreement with your presence and the reason that you're there. So we've talked about that one-to-one case management and observation. So after you've observed, then you might want to identify specific aspects of care that you've observed, or specific cases that you want to discuss together. And then you could perhaps move on to conduct some on-site trainings based upon the need expressed or the gap identified. And this is often where it's useful to bring in colleagues. You might say, well, to the team, well, so-and-so and I have decided that we're going to go through a training on vaginal breech delivery on next Friday, and we'd like to welcome any of the rest of you who might like to join us. So make sure that you maximise that opportunity, as it were. And then it's always good to think about making some sort of assessment so that you can see whether you're reaching your goals and making the progress that you'd like to make. But mentorship is not primarily about assessment, it's about providing support for growth. So assessment is a secondary matter that's just a means of documenting and determining how much of that growth has happened, but it's not the be all and end all. It's very important then that you document what's happened during your visit and what you've learnt together. Now, it may be that a mentor-mentee relationship is for a set period of time, and that you've planned it that way. And so when you come to the end of it, you might want to review and celebrate the achievements that you've made together. And important that you acknowledge that it's come to an end rather than just let it fade away and don't acknowledge that. Or you might decide that you will continue for longer than you originally thought about. That's often something that happens as well, if that's practical, for some further learning to take place. So we need to think about evaluating that mentorship process. And to do that, the mentor must reflect on their own practice within that process. And both of you together will reflect on the progress you've made and the goals that you've reached, the targets that you've achieved, and then thinking about documentation and filling in a logbook so that you can look back then and see, yes, we did this, 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 and this, and it's good to have a record of those achievements. So now we've thought about the steps in the mentor-mentee relationship process, both initiating that relationship and maintaining it, and then sometimes drawing it to a conclusion as necessary. So thank you very much for listening.